Okay, I think we're recording now. So
Okay.
I have, so this is an announcement for the in-person people here. Your question note cards are sitting on the desk. It looks like it's just to the left of Kenzie. I always lead these discussions off, and I'll ask the first question here. But I've asked everybody to turn their camera on, and then they'll just unmute. I think you know, the Zoom etiquette will be, again, this is for you people that are in person here. If you just want to raise your hand, or if you can press the reactions button. Do you all know how to use the raise hand button on Zoom? Tanner, Savannah, Mackenzie, Jenna. If you, when it's your turn to ask a question, why don't you just put your hand up just like Tanner did. Nice job. And then these guys, my intent is always to have them lead the discussion and have them lead the discussion or the conversation. So they'll pass around a few of our question note cards in case they get stuck. But the first question I always like to ask is, if you can share, you know, your educational background starting in high school, and then what led you into the current position you're in at Fairview.
You bet. Well, good morning, everyone. I know it's early. My name is Janelle Christe, and I'm the nurse manager of perioperative services at Fairview-Northland here in Princeton. I have worked for Fairview for 20 years. So I started my journey back in, well, I'll sit way at the beginning. I went to high school in Barnesville, Minnesota, which is kind of up by Fargo, North Dakota, and went to college at Concordia College in Moorhead, Minnesota, which was a 4-year school to get my bachelor's of science in nursing. And while I was going to school, I got my nursing assistant's certificate, and I worked as a nursing assistant all through nursing school, which is, if you're thinking of doing a career in medical, I would highly recommend starting with something like that, getting your nursing assistant and working in a nursing home or home health or a hospital. It just really kind of gets your eyes open to the career you'll be doing. So I did that all through high school and college. And then as soon as I graduated from Concordia, I moved right down to the cities, and I started at Fairview-Southdale in Edina. And I worked on a med surge, like an ortho neuro floor, tele. So we did a bunch of, you know, total knees, total hips, stroke patients. We would monitor the heart rhythms for if it was a stroke. That worked there for about 4 years. And then I did a Peri-Op 101 program, which is a program that's offered through a lot of hospitals, or you can actually go to even a technical college and do this. You have to be a nurse first, but it's to work in surgery, you have to have either experience in surgery, which is, how do you get that if you can't just have surgical experience. And so I did this Peri-Op 101 program, which was about a year course that you're doing as you're working. So I did that through Fairview-Southdale, and that's how I got to go to the operating room. And I worked at Fairview-Southdale then in the OR for 12 years. So I worked just doing circulating, which that's a different word. I know I'm trying to not have my medical jargon, but as a circulating nurse, you work in the operating room. So when your patient comes in the room to have surgery, you're the one there that's getting them ready for surgery, getting them prepped, which means like sterilizing their skin, getting where they're going to have their incision. And also you're kind of in charge of that room. So you're the patient advocate because the patient's sleeping at that time, or they're not able to speak for themselves. So it's a really kind of a cool role as a nurse, is you're there for the patient. You are watching everything to make sure that things are going well. You need to speak up and talk, if you see something, you say something. We watch the sterility of the field, and it's a really cool profession. And then for the last 4 years, I've been at Fairview-Northland here, and I became a manager. So have been doing that for the last 4 years, and it's a completely different type of nursing. You are still, I'm fortunate. I still get to work with patients from time to time when I get to go help out with if staff need help. And just, being here for my staff now is kind of my role. make sure that they're doing okay, that they're, have the resources and supplies they need. Surgery is very, we need a lot of equipment, a lot of instruments. And I say instruments, I don't mean like musical instruments, but like scissors, things that they use during the operating room, during the procedure, they're called instruments. So we do a lot of that. So it's just been a great journey. And about a year ago, I went back and I got my master's. So my master's of science in nursing, and I got that through Western Governors University, and I did that online. And that was a really nice way to do it with being a full-time working mom of 3 kids. So it was nice to do the online option. Just did it on my weekends. And that was great too. So that's my journey through nursing. I love nursing. It's amazing. The one thing I did want to talk to you guys a little bit about with surgery is there's lots of components to surgery. So you don't just have to be a nurse to work in surgery. There's, you could become a nurse, which I can give you all the information on that. There's also surgical technologists. So surgical technologists are actually right at the field during the surgery. We call it the field. So the sterile field, they're right next to the patient and the surgeon. And they're the one that are handing, I don't know if you've watched Grey's Anatomy or anything. They're the ones that are handing all of the instruments right to the surgeon. So they're right there next to the surgeon doing that important work. So that's a 2-year program. That's usually through like a community college, an Anoka Tech. There's places, I'm not real versed on all the schools, but I know that it's a wonderful career. And so many of our surge techs start out as surge techs, and then they go back to nursing school, and they become the best nurses in the operating room because they have that whole picture, is that they know how to be a surgical technologist as well as then they become into the nursing field. So that's a great path to take if you want any information on that. We also have sterile processing, which is, so all of our instruments that I talked about need to be sterilized. So we have a department in surgery that takes all of those instruments and washes them, sterilizes them, gets everything ready for the surgical case. So that's another career path in surgery. You could be go to school to become a sterile processing technician. So that's also a valuable member of our team in surgery too. The other thing in surgery, another career path is you can become a certified registered nurse anesthetist, so, or CRNA, and they are the ones that they monitor the patient throughout the whole procedure. They intubate or put the breathing tube down for the patients. They put them to sleep, as we would say. They administer the drugs that make them sleep, asleep, and monitor the airway the whole time. And that, to become a CRNA, you need to become a nurse first. So you get your RN, and then you need to work in ICU for a few years. And then you would go to school, and that's 2 additional years of school to become a CRNA. So we have lots of different roles in surgery that are all part of the whole team. It's one thing you'll learn that my favorite part about the operating room is that there is such great teamwork. You have to have a team the whole time. You need your surgeon, your CRNA, your circulator, your scrub tech, you need your sterile processing tech to get you your instruments. So it's just this whole group of people coming together to take care for that one patient that's having surgery. And it's really neat. I did talk about the operating room as being a nurse. We also have pre-post, which is, so you'll have a pre-op RN. That is your nurse to kind of get you ready for surgery. They ask you lots of questions, they prepare you for your surgery. Then you come back to the OR, you have your surgery, and then you go back to PACU, which is called recovery. And that's where they kind of wake you up and get you all ready, help you with nausea, give you pain meds if you need pain meds. And then they also, most of our patients here go home. And so they help you with understanding the education you need to be able to go home and care for yourself. So there's so many types of nursing and medical things that are really neat about surgery. So I kind of babbled, And so please just what questions do you guys have?
Yeah, I'm going to turn it over to these guys. They've all got at least one question card sitting in front of them. So if you guys just want to click the raise your hand button, or even just, give a physical sign, since we're a small group, that you're going to be the one who's talking, unmute yourself and ask a question.
Tanner?
Yep, I'll go
Hi,
first.
Tanner.
So my question is, what tool would you use in college to help you study?
Tool would I use to help me study? That's a really good question. I'm an old nurse, so it was 20 years ago that I went to college. What really helped me in college was I had to be very organized. And so I would say an old-fashioned planner, that I could write down everything, all my classes. When I had my nursing school, you have to go to a lot of labs. So it's on top of all of your classes. You have to go to laboratories and do all these additional things. And then you also have clinicals. And so having that planner and being super on top of what I needed to do every day. And then also remembering to document some time or free up some time that you said study time, because it's just nursing school can be a tough career, you're really busy. So having that was what helped me stay on top of things. Savannah.
What's the most difficult part of your job?
What is the most difficult part of my job? Is that the question?
Yeah.
I would say currently the most difficult part of my job is COVID. And I think that that's just been a challenge for everybody. We've had a lot of ups and downs in surgery, with doing surgery, not doing surgery, trying to provide the safest care. We do COVID tests on all of our patients before surgery. So it's just been a lot of, and patients are frustrated. They want to have their surgery. Sometimes they can't have their surgery because either they get COVID and they have to wait those 14 days, or even things as people, we're not able to take patients in because we're just too busy in the hospital with more critical patients that we can't do elective cases. So I think that just has been a challenge for me in the last, feels like 2 years, whatever, it's been a year and a half of just trying to be there for my staff with the ups and downs, as well as our patients. I make a lot of phone calls to patients, just trying to talk them through this COVID times and the new processes that we have to do to have surgery.
We've had a couple of additions to our group here, so they're getting themselves logged in to our Zoom. But I think the people that are here, I'll keep asking you questions.
All right, Kenzie, go ahead.
What is the best part of your job?
The best part of my job is the patients. I am very much a nurse that loves people, and I love taking care of people. So it is just a rewarding job to know that you've maybe brought somebody's anxiety down about surgery or doing something that made them better, and you were a part of that. And that's just, it's a great feeling to go home at the end of the day knowing that you actually impacted somebody's day or their life. So good question. All of you doing great.
Make sure you're muted and your sound is all the way down.
Jenna.
What do you want to talk about?
What do I want to talk about? Whatever you guys want me to talk about. I can fill you in on if you want to know anything about my history of working on a med surg floor, or being a nurse in the OR, being a nurse in the pre-post, any of these other career paths you can take.
Can I ask about, working in on the front line in surgery? I would assume you've seen some things, to say the least. So if there's anything that sticks out, I think these guys always like hearing stories. If there's, I don't want to put you on the spot and expect
No, sure.
some of the blood and guts stories, or if
Yes.
there's anything that's memorable. I think those are always good things
Yep,
to share.
for sure, I can share. So surgery can be very intense. There's times, I've done lots of cases where people come in, not so much here, but more in Southdale, when it was more of lots of big cases, open hearts, cranies, which is brain surgery, aortic dissections, or with your aorta that comes out of your heart. It's called a AAA. You can have like a abdominal aortic aneurysm where you're bleeding inside all over. I don't want to gross anyone out, but so I've done lots of cases where they come in and they bypass ER, they bypass pre-post, and they just come straight into the OR. And it's just everyone running around. It's very, I would say that's, again, like what I love about the OR. It seems like it's chaotic, but it's not. It's organized. Everyone knows what they have to do. I'm running for blood. I'm administering the blood. The CRNA is putting that person to sleep. We're getting the surge tech is getting all the instruments set up for the case. The surgeon's right there reviewing the films, which are so they know what's going on inside without opening them yet. Just running around. It's fast. It's high anxiety sometimes. But you're just trying to do the best for that patient to make them to get out of the OR and healthy and all better. But that's happened quite a bit, lots of different things. When you do those big brain surgeries or craniotomies, it's, they're coming in fast again. Those can be for aneurysms or things, they're bleeding in their brain. And it's quick. You have to get them in. It's kind of gross. I don't want to, but you use a saw and you cut and you make a flap to open up the brain, and the brain's right there. And so it's really cool if you like that kind of stuff. Some of the staff where I used to work in the operating room used to make fun of me because I found it so satisfying to do a big bowel case where you had a bowel obstruction. So, you see the intestines just out and you have to make sure everything's good. So they call it milking the intestines. And you'd think that's so gross, but I just thought that was the coolest thing. That, the size of your intestines is like a football field, right? And to think that that's wrapped up inside of your stomach is just cool. You have to kind of I always called myself a nurse geek. Like it was cool to be in there and see that and be a part of that. I've done so many things throughout the years where it's stressful, but that's why you go to school and you're trained and you know what to do. And I've never had a bad outcome in the OR. They always have made it out in my 20 years. So that's exciting. You help lots and lots of people. Anything else? I don't know how many stories I can share.
What is the worst part of your job?
I'm going to just ask for a clarification. Do you mean for being a manager or for being like a nurse?
Just in general, I guess.
In general? I think the worst part about my job is when something doesn't go right. Could be with, just conflict between staff members. We're all human. The other thing is that So having to deal with that is always, it's not fun to have to talk to people when maybe behaviors aren't the best. The worst, another thing that is probably not my favorite is when you have a patient that's very upset about something that maybe was out of your control or out of anyone's, to just are upset about something. And that's never fun either. But it's part of, everyone has a viewpoint, I guess. And so yeah, that's probably my least favorite. Us nurses like happy. We want things to go perfect, and know when things don't go perfect or don't follow that right path, it's like, ah. Good questions. Jenna, do you have another question, or is your hand just still up? I always do that. I always leave my hand up on these meetings, so I get it. Does anyone have any questions about the other roles in surgery? Like being a surge tech or anything like that I can try to help with?
Thomas has got a question, but I think he's frozen. Thomas, you want to unmute and see if we can hear you?
Yeah, can you hear me?
I can hear you, yes.
Okay, question. What's something that can like go wrong during surgery or something that can happen, and what do you do if that happens?
Yep. Something that can go wrong during surgery, was that the question? What we do?
Yeah.
Okay. Yes. Things can go wrong. Sometimes, you can have issues with bleeding. They get in there and things maybe a lot more blood than what you would anticipate having. And so at that point, you're really trying to warm the patient, keep them warm. We're giving them lots of blood and fluids to replenish what's going on. The surgeons are amazing. They know what to do. They use lots of sutures or ties, they call them, or we use devices that is called a cautery, which is actually like an electrical unit. It sounds crazy, but it's electricity that goes to a pencil. And so it cauterizes things that are bleeding. And so it's just like, it seals it, stops the bleeding. Or they use what's called ties. And so they'll, take the suture without a needle and they'll tie it around, and they tie it up tight and cut it, and that closes it off. We have machines that are called, like we have one that's called a ligature. And that's another machine that you use. It's got a handpiece and it has like jaws. And so it would go over the vessel, and they squeeze it and it beeps, beeps, beeps. And it just seals that vessel so it stops bleeding. Those are kind of the things, that's just a bleeding example. Other things that can go wrong is everybody's body is different. So sometimes you can get into doing a case and, things just don't look the way they should. And so sometimes you can have problems with, you didn't want to involve the bladder, I could say, like where you have your urine, you don't want to, and so you can have issues where you have injury. So there's complications to surgery. And so that can be where you have to have another surgeon come in and fix an injury. Just trying to think of other things that go wrong. We do a lot of safety checks in surgery. So that is a big part of what we do, is we do what's called before we have surgery, we do a pre-op brief, where we talk about what we're going to do. Everyone's on the same page. We know what we're doing. Then when the patient gets into the room, we do a timeout. And again, we talk about everything we're going to do. What are the safety concerns that we have? Do we have everything we need? And then we do one at the end as well. We do a debrief, and we talk about everything that went well or things that we needed, talk about what specimens we're taking. So there's so many safety checks in surgery, which is, it's what makes it such a successful thing, is that the nurses, techs, and CRNAs and surgeons are always on the same page about what we're doing. If ever a step is missed, that's when something can go wrong. So that's where we always are just really talking about, we have to do all of our safety checks so that we make sure our patients are taken care of. We count a lot in surgery. You've probably heard that before. There's a lot of instruments to count, a lot of sponges, a lot of needles, blades. And we always want to make sure that nothing's left behind. And so you wouldn't ever want to leave anything in a patient that they didn't come in with. And so we do lots of counting. We count before the patient comes in the room. We count multiple times throughout the case, just to make sure we're all on top of what we have. If ever we're missing something, or we can't, it's called a count for something, then we take an x-ray and we just make sure that nothing's left behind. A lot of times it's a needle, and so they're small and you can lose one. And so then, we're using a magnet, we're trying to find the needle, we're taking an x-ray. A lot of times we find it after the patient's, once you do the x-ray and you make sure it's not in the patient, most of the time you seem to find it under the bed after the patient's left and you can move the bed. So those are things that, things happen. But we always have a backup plan, or what we're supposed to do next in those situations. And I have to ask, Mr. Jacobs, is this kind of what you want? Am I doing what you're kind of wanting for me to talk about?
Yeah.
Okay.
These kids, they have questions, and we've been through this process a few times.
Okay.
I think it's just a little different because we're on Zoom, but that's okay. Yeah, we wanna ask as many questions as we can to kind of figure out what it's like and what your journey was like. So another question, I wrote down a couple that I think are always good to ask. One being, what would a perfect day for you look like? So if you're on your way home today, for you to be able to say, man, this was a great day at work. What are some things that happen?
For sure. I'm going to take that as if I was working in the operating room, because I'll do two ways. So as a manager, the perfect day is when I come in, I have fully staffed departments. So I'm over 3 departments. And so if all 3 of my departments, I have all of their people there, they're working like a fine oiled machine. We're not working short. Everybody's in a good mood. We have a full surgery day. Full surgery days are the best, because sometimes, if you have little breaks, you kind of get out of your groove. So it's just nice when you have a full day of cases, and everyone's just working. Great teamwork. Teamwork is literally what makes surgery work good. We need to have that. And so that's what makes a great day as a leader. And knowing that my staff left the day feeling like they did good, and that they changed maybe somebody's life for the better. And so as a leader, I'm thinking more of my staff. I want them to be okay and having a great day and doing everything they can to be successful for our patients. It all ultimately always comes back to the patient. And then as a nurse in the operating room, a great day was when I had all of the equipment I needed. Everyone came on time. Then the cases just went smooth, everything, no hiccups. I didn't have to run for too much stuff. That sounds kind of weird, I suppose, but as an OR nurse, if you don't have the needed supplies in the room, you're in the operating room that you're in, you have to run and get it a lot. So that's what the circulator is. They're the runner. So they run and get all the extra supplies they need, extra instruments, things that they need. And so you feel like you're kind of behind the ball. So I would say a great day is when you have all of that, and quick turnovers. That always was so turnovers mean that between one surgery to the next surgery, it's called turnover. So in that time, you're cleaning the room, getting ready for the next case, opening all of your supplies and instruments. And if that goes efficiently and smoothly, it's just a nice day. If all of your turnovers are just efficient and smooth, again, that's a lot of thing with surgery, is efficiency and teamwork. So that makes a great day. And I will say, from coming from being a floor nurse, they have obviously amazing teamwork and they do great, great work. The difference is I feel in surgery, you are definitely, I've said this multiple times, but you need everybody, everyone works together. And if one thing is off, then it just isn't as good. So I do love that about surgery, is you're never alone. You always have your team members.
What's the best career advice you've received?
The best career advice I received was both of my older sisters are nurses. And so what I learned from them was we all played sports in high school. And both of my sisters went to college and they continued to play sports, which is amazing. It's great. They both felt overwhelmed with their nursing career and trying to do that. So they ended up, stopping sports. But their career advice was to really focus on school and, not continue with that, which I could have, but I didn't. And I'm so glad I didn't, because I did get done with school in 4 years, which is a 4-year program. And as I think focusing and getting done in that timeline is something to be proud of. And it's tough, but if you put yourself, fully invest yourself in that schooling, you can do it, and you'll be so much happier that you did that. So that was my great advice. My sisters were like, Janelle, just go to school. Focus on nursing. It's a lot.
I've got 2 more questions that I jotted down here. Is there something specific that led you to the career that you're in today? And I ask that because anytime I teach this class, there's going to be a number of kids that might not be interested in a health career, and some that are. So, talking to people about what led them into the profession and the vocation that they're currently in, I think is an important part of this class. So it doesn't have to be one singular experience, but some people have experiences like that lead them down a career path. So if there's something you could share with us that led you into the position that you're in.
Yeah. Well, like I said, both my sisters were nurses, and then my parents were both in the medical field too. And so that just kind of drove me to nursing. That was really what got me involved in it. And also working as a nursing assistant throughout high school, it really just solidified the fact that I liked patients and I like patient care. And that just really kind of was the best thing I ever did, as I knew I've never had a job that wasn't nursing. It was my first job was a nursing assistant, and I've been a nurse ever since. So I think that it kind of made it clear that's the path I wanted to take. Going into surgery, the reason I chose to go into surgery and do that Peri-Op 101 program was I worked on that ortho-neuro floor, and a lot of the surgeons I worked with were ortho surgeons or neurologists that did, neuro, spine, or, brain or back. And they always told me how much they love surgery. And so I was like, I'm going to do this. This sounds really cool. Not that I ever thought I was going to be a surgical nurse. I actually thought I was going to be an OB nurse when I came out of college. And so they talked me into it, and I did it, and I love surgery. The reason I went into management, I would say I, had all this wealth of knowledge and experience that I gained from working on the floor and working in the OR. And I think I just wanted to advance myself and do something that challenged me. And it has challenged me, and that's a good thing, to always be trying to, what's next? Like we'll say, what do I want to be when I grow up? I mean, I'm old and I'm still saying, what do I want to be when I grow up? I know I want to be a nurse, but do I need to be challenged again? And so this has been a challenge for me. This is what brought me into this role. And I think as being as a nurse as long as I have been, seeing great leaders, good leaders, and not so good leaders. We all have our skills and our abilities, and learning from each and applying that to my day-to-day work It's been good. Experience is good.
This question came from Mackenzie Kruger. She's got a question.
What was your first job?
My first job was I was a nursing assistant in a nursing home in Moorhead, Minnesota. And I shouldn't say that, I was called a homemaker. So I did not have my nursing assistant certification yet. And so, but they would send me through the certification if I started at the nursing home. So my very first job when I was 15 was a homemaker. And I worked at the nursing home and I did hair. I made beds and I talked to the residents. That was my job. And then from there, like I said, I got my nursing assistant, and nursing assistants they work super hard. They're hard workers. So you do all the cares that the nurses, help them get dressed, get them ready for the day, help feed, do all that kind of stuff. So those are the only jobs I've ever had. I haven't even worked as a waitress. Sometimes I feel like I should do something different, but I guess when I had my calling.
What do you want people to know about being a nurse?
I think people need to know that nurses are always looking for the best interest of their patients. I think that nurses are strong advocates. They put their whole heart and soul into the work that they do. And so sometimes I think you hear a lot, and you've probably heard a lot on the news lately about burnout. Nurses can, there's a lot of stress in nursing. There's, it's just can be tough sometimes, but I think that nursing is one of those professions that is respected. It's nurses, you're going to see your nurse so much when you're getting care. Obviously your provider, your docs and surgeons they're vital to the care you receive. But I do think that nurses are, they're that face, and they're the person that patients a lot of times are going to relate to, or, really want to connect with. And so nursing is definitely it's a science of medical, but also a lot of heart.
We've got 5 minutes left here, Janelle. So
Okay.
just kind of in closing, this doesn't have to be the last thing, but oftentimes this is the last question that I ask, is if you could leave this group of kids in a health careers class, maybe they end up in a health career, maybe they go a completely different route. What advice would you like to leave them with?
I think the advice I would give you, if you are going to do a health career, do that health pathway, going into school to be a nurse or a tech or a doctor or a CRNA, is the best piece of advice I can give is start out at the bottom and become a nursing assistant. They're not the bottom, but start out with working as like I did, a homemaker or a nursing assistant, and see the whole picture. I think that people that have done all of the roles, you have a better understanding for the people you work with. It's just the way to do it. You just need to kind of see the world of healthcare from all angles. So I think that if you're doing that, that would be my advice, is to volunteer in a hospital, clinic, or become able to work in one of those areas if you want to do that. The other advice I have, if you're not going health care wise, I think that, making sure that you do your research and find out if that's kind of what you really want to do. And it's a hard decision for us young, when you're young, to make that decision for, what am I going to do? What am I going to be when I grow up? But I think that you always have a chance to change too. So, that'd be my advice. Just really get out there and see it before you choose to do it.
Awesome. Thank you so much for joining us, Janelle. I do kind of want to wrap up here, so I'm gonna stop recording.
Perfect. Well, thank you guys so much. If you ever have questions, I can give my phone number and email to Mr. Jacobs, and you guys can always reach out to me. I'm always